Assalamu alaikum. This is Dr. Komal, FCPS gynecologist and mentor for Ops and Gynae for FCPS, IMM, MS exams. So this podcast is about the early pregnancy. In the early pregnancy template, first of all, you will introduce yourself. After that, there are 3 points that are needed to be addressed. First of all, is there any bleeding? If it is present, then what is the amount? Whether it is associated with the vesicles? Is there any pain? Along with that, what is the duration and intensity of pain? The onset, severity, character, and whether this pain is associated with any vomiting? Are there any aggravating or relieving factors? And any medication that she has taken so far for that problem. The last point that needs to be addressed is the vomiting. How many episodes of vomiting were there? Any usage of medication for this problem? Any associated urinary or bowel complaints? As well as you have to rule out any UTIs, any GIT causes, history of any fever, history of any such problem in the previous pregnancy, and along with that, any ultrasound done so far to rule out any molar pregnancy or a twin pregnancy. Then the general questions that you have to ask the patient is about, in the pregnancy, is this the patient's first visit? Any tests done previously? And is she taking any folic acid during this pregnancy or not? After that, you have to check for the past obstetrical history. During the past obstetrical history, you have to ask the patient regarding the history of hyperemesis or any problem in the previous pregnancy for which she took medication regularly. Then after that, you will ask the gynecological history. What is the last menstrual period of the patient and regularity of the cycles? Any contraception he has done. After that, you will ask the patient about the past significant medical history, like for diabetes, hypertension, asthma, TB, or any other problem for which he was taking medication regularly. And then comes the surgical history and family history. After that, you will ask the patient for any personal history like smoking, addiction, or any history of blood transfusion in the previous pregnancy. Then, according to the scenario, you will move forward. Like if it is the case of a breaking the bad news, like if the patient is having any ectopic pregnancy or molar pregnancy or the missed pregnancy, you will address the patient empathetically and will break the bad news by following the spikes model of breaking the bad news. At the end, you will address the concerns of the patient and the management will be done according to the cause. You will close the consultation after telling the patient for the follow-up and giving the contact numbers of the hospital and as well as booking her appointment with the consultant. At the end, you will thank the patient and will ask her to revisit or give her the follow-up date and ask her for the compliance. That's all for the early pregnancy template. I hope this helps you in your exam. Thank you very much.